Briarcliff fourth grade teacher Stephanie Hughes loves her work, but if this Wake County school teacher forgot to take her heartburn medication, it made for a long day.
By 10 or 11 o'clock in the morning, I was just constantly being distracted by, the pain of the heartburn and the indigestion. And it just seemed like every single day I had heartburn. It didn't matter what I ate, what I didn't eat.
Doctors diagnosed Hughes 10 years ago at age 20 with GERD, gastroesophageal reflux disease. She took medication for GERD for a decade with a not-so-promising prognosis.
I would need to possibly be on medication every day for the rest of my life.
Even with medicine, her symptoms grew worse this year.
She would bend over or she'd move the wrong way. She would feel her stomach contents come up into the back of her throat. Sometimes she'd spit it up. It was starting to make her very hoarse because she had so much acid coming up into her throat.
From uncomfortable to unbearable to what Hughes calls frightening.
There were 3 or 4 times that I can remember that were pretty frightening for me because I would actually wake up in the middle of the night choking because things were happening even as I was sleeping.
Dr. Naveen Narhari with Digestive Healthcare, seen here in Rex Endoscopy, performed an upper endoscopy, which shows physicians clear images of the esophagus and stomach. He immediately saw the problem.
The upper muscle on my stomach wasn't just loose, but it was completely gaping. It wasn't closing at all.
This is the esophagus. This is coming down into the stomach. And just to illustrate, this is where the problem is in people that have reflux. This sphincter right here, or this valve, allows acid to go up into the esophagus in people that have reflux.
Surgeon Daniel Vig with Capital Surgical Group shows us a view of this common problem with a barium x-ray of the upper GI.
When people have reflux and are candidates for surgery, we take this part of the stomach right here and wrap it around itself and recreate that valve.
To determine if surgery was an option, Hughes needed a manometry test, like you see here, to find out just how well her esophageal muscles move food through the esophagus.
They actually put a tube going up your nose and back down your throat into your esophagus, and then they measure the pressure in your esophagus while you're swallowing.
With Hughes's esophageal muscles working fine, Dr. Vig performed the Nissen Fundoplication procedure. In most cases, the surgery is done laparoscopically, requiring only 5 very small incisions. Here's how it works.
Imagine the stomach is like a bag, and there's this big part over on the left side that we take that floppy part and sort of wrap it around itself. And what we do is recreate the valve between the esophagus, which is the tube that carries food down to the stomach, and the stomach itself. And so we recreate that valve so that acid doesn't go up into the esophagus like it used to. 80% of people will have complete relief of their symptoms and not need antacids anymore.
After 10 years of suffering, no more heartburn for Stephanie Hughes.
I haven't woken up in the middle of the night choking at all since then.
She doesn't have to worry about, did I forget to take my medication?
I don't have to think about it at all. It's great. And I can drink as much water as I want and then bend over and pick up a pencil that fell off a desk and not have to worry about a thing. It was life-changing.